everyone, today's video is on syncope, also known as fainting or passing out. And this video today has a big disclaimer, and that is very rarely passing out can signify something much more significant or dangerous. So always, obviously, definitely consult with your child's individual pediatrician. But the vast majority of the time, passing out is something that happens for predictable reasons. And that's what we want to talk about today, because we see this in private practice all the time. So I want to break it down, possibly oversimplify what we're talking about here, just so it makes it easier to remember, easier for me to explain, and just easier for all of us to understand what could be going on. And hopefully from that, make some practical, easy to remember tips to help prevent episodes of syncope. So let's think about this. I told you it was going to be oversimplified as a problem of plumbing. Our brains need a certain amount of perfusion pressure. It's called cerebral perfusion pressure, or CPP. If for whatever reason your brain is not getting adequate CPP, cerebral perfusion pressure, it's just going to check out till it does get adequate pressure, and then you'll come back around. And so the patient could experience loss of consciousness. Now, this is just meant to be practical tips, so I'll tell you this. I most often see this in teenage girls. It can happen to anybody at any time, both genders, of course, but just practically speaking, at least the ones who seek their primary care provider for assessment of this, it's usually teenage girls, for several reasons that we'll talk about, puts them at slightly increased risk. So think about your brain needing pressure, and think about your brain needing certain substrates like oxygen, of course, and glucose, of course. So we're gonna break the causes of fainting or syncope down into lack of pressure or lack of substrates. So in the pressure department, there are several things that could happen that could suddenly make your brain not receive adequate pressure. Think about this. Well, I'm picking on the teenage girls. It's because during that time is rapid growth. And this is the way I think of it. If your body's blood pressure maintenance mechanisms haven't adjusted to your new taller height, your increase in inches in height, maybe if you rapidly go from a lying position to a standing position, it just can't keep up with you. And so your brain suffers from a lack of perfusion there for just a second, and you get all woozy and can nearly pass out. Honest to goodness, I used to see this particular thing even more, I think. So imagine back in the day with me, if you will, before everyone had a cell phone. And this teenage girl, our pretend patient, was lying in her bed, in her bedroom, and she heard the family's only telephone ring in the living room. And she sprinted. She rose from that bed, she ran down the hallway, and about the time she picked up the phone and said hello, down she went. And that's called orthostatic hypotension. That means that there was such a rapid position change that the blood pressure bottomed out, and then the patient could pass out. So the treatment for that is just to change positions slowly. So if you're relying on your bed and you needed to be somewhere else, how about you just sit up a while in the bed, and then you swing your legs over for a while, and then you stand up. Just don't be in such a hurry. So positional changes can result in syncope or nearly passing out. Or even sometimes we just call it pre-syncope, meaning you had all the symptoms of just about to pass out, you just didn't completely finish that process. Now, let's also think about this as pipes. If those pipes bringing the blood to your brain don't have enough fluid in them, if you are dehydrated, that's going to increase your odds of passing out for all the reasons we just talked about. There's not enough cerebral perfusion pressure because you just don't have enough liquid in there. So staying well hydrated helps prevent episodes of syncope. Other things that can happen, think about this too. If your body is trying to cool itself down, do you know what it does? It sends blood to the edges, the periphery, to cool that blood down. So here's a classic example. I have seen this more times than you could imagine. Teenage girl taking a 30-minute steamy shower. Her core body temperature is rising, and so her body's trying to cool itself down. So it sends all the blood to the periphery, and by doing so enlarges those peripheral blood vessels. Well, think about the pipe analogy again. If a pipe is suddenly larger, what happens to the pressure inside the pipe? It goes down. So her cerebral perfusion pressure suddenly crashes, and down she goes and passes out in the shower, often hitting her head. You know, the bathroom's a pretty dangerous place. It really is. And so for some reason, I have seen it so many times through the years that maybe the girl's at home and her dad's at home, and he hears a thud. He's afraid she's dead. He drags her to the bed and calls EMS, and she wakes up horrified that her father has seen her naked. He's just happy she's alive. And often we see these in follow-up to remove sutures because she may have hit her head on the way down. So that was all from the peripheral vasodilation, the blood vessels getting too big in the edges to cool down the core body temperature, and down she goes. So be careful about that too. Another extremely common cause, and this could have a video unto itself, but I'm trying to be concise, is called vasovagal syncope. Now you guys have always seen examples of this in videos through the years. Of the classic example is the father present at the baby's delivery, at childbirth, and whether from a surge of joy or fear or the sight of so much blood, down he goes. His knees buckle and he just passes right out. But it can happen from a surge of any sort of emotion, or a surge of pain, or a surge of all sorts of things, a sudden change in emotional state or condition. And the way it works is the vagus nerve tells the heart to slow down and for the blood pressure to lower. So imagine how we've been talking about pipes and cerebral perfusion pressure. If your blood pressure is suddenly lower and your heart rate is slower, your brain's just not getting everything it needs, and so down you'll go until it does. And so there's not a great cure for this one, except just being aware that it could happen if you're very sensitive to the sight of blood, perhaps, and just knowing the symptoms of pre-syncope, so you take measures to get more brain blood pressure so that you won't go down. Now, those are the very basics. I told you, we're simplifying here for pressure causes of syncope or passing out or fainting. Let's talk about substrate causes. So again, these are just the two biggest ones. One of them is blood sugar. So if you have hypoglycemia or low blood sugar, your brain's not getting adequate nutrition. It can also check out or have an episode of syncope or fainting. And so a lot of people think, well, gosh, I just had a donut. I couldn't possibly have low blood sugar. Actually, it's sort of the opposite. Think about if you had a breakfast of maybe a sugar soda like a Coke and then a donut. Your sugar is high there for a minute, but your body, as long as you have all the normal responses, squirts out insulin to process that. Did you know you could have a rebound and actually go lower than you should because you over squirted out the insulin in response to that very sugary breakfast? So what we would recommend is, first of all, don't skip meals. Many teens are famous for skipping breakfast, skipping lunch. They're just really bad about eating regularly. So do not skip meals if you're prone to passing out. But also at each of those meals, if you could include some protein and some complex carbohydrates like fiber, it's just gonna last you longer than a big bolus of simple sugars that's gonna result in a high and then a crashing blood sugar. So do be careful to not skip meals and get healthy foods. The other lower substrate could just be oxygen. So you know in our body we have red blood cells that have a molecule called hemoglobin to carry oxygen. Our bone marrow needs iron to make adequate supplies of hemoglobin. So if you're not getting adequate iron in your diet, or if you have excessive blood losses like some teen girls with very heavy menstrual cycles, then they could be anemic and not be able to adequately carry oxygen to the brain, and that could also result. So a lot of times if you did bring your teen girl or son in for an evaluation of an episode of passing out, we may check a blood sugar and we may check a complete blood count just to verify that they're not anemic, and that's why we would do that. So we have talked about all the things that could result in an episode of passing out, but let's talk about, maybe you don't have to go through that if you could become aware of all the symptoms that you'll feel before that happens. So most people before they pass out have some little tiny clue before it actually happens. Their vision may become sort of like tunnel vision. Things may be blurry. They may see spots or dots. Hearing might sound, may sound funny, sort of like Charlie Brown's teacher on the cartoons, womp, 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 womp. Stuff gets very distorted and weird sounding. You may feel a surge of nausea. You may feel clammy and sweaty. It's really a bad feeling, all these things before you pass out. So if you felt any of those and you know you're prone to passing out, if you're standing, could you please sit down? If you are sitting down, could you put your head between your knees and get more blood to your brain? If that doesn't work, lie down. If that doesn't work, lie down and lift your legs so that all that blood goes to your brain, and it'll usually reverse all of those symptoms that you're feeling, the nausea, the clammy, the funny vision, the funny hearing, and all those things. So I hope that's helpful so that we can prevent further episodes. Now, like I said, you cannot take this for granted as being something simple simple, but if you had a perfect storm of these things, which is often what happens, maybe it's a girl who does have heavy cycles and she skipped a meal and she isn't staying hydrated and she changed positions rapidly and then it happens, you're probably okay that that's in the normal realm of what we would expect because she had so many risk factors. But always call your child's individual pediatrician to ask about this, as there could rarely be more serious causes for syncope. I hope this has been helpful. Thanks.